even though if you look at Indigenous rights and Indigenous health, Indian Ayurvedic, other spaces, there's tremendous amount of data and really good information around how we can combine, regular scientific hospital work along with, traditional methodologies of healing, and how important that is, again, for the spiritual side of us, for healing, right? And I think the system, like for example, in Alberta, we have only 4.3 million people in our entire province. Our province is massive. We have 4.3 million people, and we spend $24 billion on healthcare, 24 billion on healthcare, and people can't access the systems appropriately. We are short on doctors, nurses. There's 12 to 13 hour
What's causing that?
It's everything. So the system is set up so that there's only certain pathways into the healthcare system. So you have your doctors and all that. And because people think, this is why the other side is also important, to have a private public healthcare system. I think that there's a hybrid system, because the average Canadian thinks that healthcare is free, and it's not. We spend tremendous amount of tax dollars on a healthcare system that really has a hard time serving its people, because so much of it goes to places where there's no accountability around whether that's management into a system. The actual, like if you look at AHS as a system, I think actually their operating system is quite good, but where it is lacking and is actually getting to the frontline services. There's so much of that money that is lost in the bureaucracy of running the system that the actual dollars aren't going to the people and to the actual service of people. And what healthcare is mentioned, I mean, it's not a privilege, it's a human right. So I'll always defend the public system, but we need to expand, right?